fighter for Medicare for all, Daniel Lee.
So I usually don't do this, but since it's getting a little late and I know people might be a little low energy, I'm going to ask you to repeat after me once when I start to talk, and then repeat after me once towards the end. But maybe it's right. My name is Daniel Lee. I try to tell people now since I finished my doctorate, Dr. Daniel Lee. Vice Mayor in Culver City. I ran and lost in California State Senate District 30, but we don't need to talk about that. I'm just going to say the first thing I want you to repeat after, and you just repeat after me. Just do it right after I say it. The United States of America is a sick country.
The United States of America is a sick country.
It is a sick country. It's so sick that in the 90s, the CDC declared gun violence a public health emergency. The United States is a sick country. It's so sick that just last year, the County of Los Angeles and Milwaukee County in Wisconsin declared racism a public health emergency. It's so sick that each year the fire season is extended from 6 months to 9 months to 12 months a year here in California, yet still we can't pass legislation in California or on the federal level to address climate change. So what do we do? What do we do when our government is sick and our politicians don't listen to us? We get out on the street. We march like we marched today. We march like we marched last year for George Floyd. We let them know what's up. But we got to do more than march. Because frankly, a lot of us who are marching are sick. We're sick in a different way. You've heard a lot of stories from people today about their personal stories of themselves, their family members, their parents, either with insurance or without, who still couldn't get the care that they needed. When I ran for state senate, I wasn't bashful. I told people, I have had about 5 or 6 chronic illnesses for about 14 years. I mentioned it because I wanted to contrast my experience with the healthcare system before I was an elected official and my experience afterwards. Before I was an elected official, I had health insurance. Still, my neurological medication, my rents each month, the price. I had health insurance. Still, my monthly premiums were $400. I was paying more for my rent and my prescriptions than I was for my health care. And this is over a decade ago with insurance. And my health conditions aren't that complex. Unfortunately, like a lot of people, last year I got sick. I was sick for about 6 months. I only had to spend a couple days in the hospital at Cedars-Sinai. I spent 2 nights. But I saw about 35 doctors last year. Do you know how much that would have costed when I wasn't an elected official? It would have easily been $50,000, $60,000, maybe for the hospital stay alone. But since I was an elected official, my total last year, hospital stay, doctor visits, multiple prescriptions across the board was about $500. $500. So when we talk about Americans who are tired, and we talk about Americans who are suffering from income inequality, they're suffering because they have debt. And a significant proportion are suffering because they have medical debt. So when we hear from politicians, some may or may not have been here today, who say that they want to sponsor a bill like AB 1400, we say to them, we don't just need a co-sponsor, we need a co-conspirator. We need somebody who's going to put their neck out and put their job on the line for what is right. What we we really want to say, and this is where I want to have you repeat after me again. What we really want to say to all of the elected officials who say they care about us, who say they support this, who turn their backs, who abstain, who are somehow not in the room when the vote actually comes up, repeat after me. We want what you got.
We want what you got.
One more time. We want what you got.
We want what you got.
Because all of our elected officials, not just in California, federally and states across the country, they have good health insurance. They have single payer. They have their version of AB 1400. Some of them, frankly, don't give a fuck about us because they got theirs. But we need to let them know. We might have marched through Hollywood today. We might be marching in over 50 cities around the country today as well. But this is not the last time you will see us. We're not going home. It's what you got. And we're not going to stop marching until we get it. Thank you.
Folks, that was Culver City Vice Mayor Dr. Daniel Lee.